as a country, our perinatal death, that is when I talk about perinatal death, these are babies who die before reaching 1 month, has been very high. We are at 22%. That means of 100 deliveries, we are having over 22 babies die. When you deliver 100, at least 22 of them die. And most of them who die, actually, these are due to preventable causes. Preventable causes meaning that poor health-seeking behaviors of the mothers during antenatal, and also when they do not take their medication well, like folic acid, malaria in pregnancy. In pregnancy, there is prophylaxis against malaria, where they give Fansidar, but sometimes as a region, we are very endemic for malaria. Actually, we are the hot spots for malaria. So malaria causes a lot of morbidity in these babies. Mothers end up becoming anemic, so they end up delivering their babies early as 5 months of gestation. Or in the event that they are delivering, they may end up with complications which actually make these babies sick. So this has been a concern in the region, and we have been advocating for improvement because we want the under 5 mortality to reduce, but what is stagnating it is the perinatal mortality rate, where we are losing a number of babies. We've done a lot of activities to see this, and one of them is ensuring that we strengthen all the health facilities in the region under the local maternity and neonatal systems. We have a weekly meeting which occurs every Tuesday, and all the health centers, we have meetings and we discuss matters affecting these newborns. We've also tried to strengthen the region by setting up neonatal units in all the health center force. In the event that the babies are sick, we take care of them in the NICU. There are challenges, and one of the major key challenges which we got is the numbers actually of these babies are very high. Why? Because of what I mentioned early. The nutritional status of the mothers are not good. So majority of the mothers may have anemia. This ends up with complication. And then we've had cases where malaria, mothers are not preventing malaria, like we have the insecticide-treated mosquito nets. They are supposed to take Fansidar during pregnancy, but sometimes challenges, there are stockouts of Fansidars in the facilities, and these mothers end up with malaria, and the malaria, actually the outcome is a sick baby, and the baby comes too early. And then we have also high incidences of young mothers. Many mothers, majority of the mothers with complications actually tend to be young mothers. So our region has a high prevalence of early marriages, and women are giving birth when they are still very young. These children do not actually carry the pregnancy to term. These children come out quite early and has to be supported, and supporting them incurs a lot of cost. And then we also have lack of family planning. When a mother gives birth, she loses a lot in terms of nutrients. So the next baby, she needs time for the body to recover for her to carry a healthy next child. But you find mothers giving birth frequently. This has actually led to the outcome of the pregnancy not being good, as I'd said earlier. So we have to strengthen family planning, and also the number of children. You get a mother with 12 children. This mother is worn out and cannot sustain. Also complications like hypertension, or what we call preeclampsia in pregnancy. Sometimes medically, the doctors induce these babies and then they come out. So all these are the many causes of babies who end up in the neonatal intensive care unit.